Hi everybody, I'm Dr. Sam Curtis, and today we're going to be talking about one of the most common reasons that a pregnant woman enters into a chiropractic office, and that is low back pain. I'm pretty sure that's the most common reason that any person goes to a chiropractor, but in pregnancy, that's our focus. So, there's a couple of factors going into low back pain in pregnancy. Number one, after like 32 weeks of pregnancy, relaxin is highly prevalent in your body. So any previous injuries that you had going all the way back to when you were like 5 years old and you fell off of a bicycle as you were learning to ride without training wheels can come back to bite you. The other side, and this is the one that I tend to focus on a little bit more, is that if you're just a healthy individual and you haven't had any major traumas, you can still have low back pain because as that baby that you're growing so well starts to expand above your pubic symphysis and grows out, your center of gravity actually moves forward. It's kind of a cool thing. So your center of gravity can move up to 6 inches forward in your body. Now, with your center of gravity, meaning all of the weight and where it falls on your feet goes an extension of your low back, meaning that the curve in your low back that's normally there is actually accentuated and gets more, it gets larger. So the big thing about that is that the muscles of your low back start to have to stabilize your body for you. Given that, as well as maybe if you have an increase in breast tissue as your milk comes in, we're talking about even more curvature of your thoracic spine. So that tends to exacerbate any additional pain that you're already having. And then if we go back to relaxin, relaxin loosens up those joints, and then any pain or any micro traumas that you've had previously, like bad posture, sitting too long, things like that, they all become a really big deal. So what do we do and how can we help? So in this office, my husband and I do something called Webster technique, which is a methodology of adjusting a pregnant pelvis and making sure that the pelvis can move freely from side to side. This type of approach makes sure that the ligaments and the structures of the pelvis are balanced so that your baby can do everything it needs to do. So for instance, if your low back is straining just to keep you upright when you walk to your car at the end of the day, this is going to cause problems later throughout the evening. So maybe you're sitting a little differently on your couch. Maybe sleeping is not very comfortable anymore. Things like this are things that we can help to make sure that everything is calmed down a little bit as your belly grows bigger and bigger. Another big factor that comes into this is actually posture and exercise, which I'm going to talk about in other videos. One of my favorite things to do for my pregnant patients after they get adjusted, especially using Webster technique, is send them out on a walk. So it's very likely you may come into the office and I may say, go walk around the building and come back. Walking is really great because unless you have an anatomical short leg, which is very rare, what you're going to be doing is you're going to be swinging and moving your pelvis as you walk, which allows everything to free up a little bit. In the adjustment, we're specifically concerned with the nerves. However, those nerves are going to the muscles. So if we can get those muscles nice and relaxed on the same side, on the right side and the left side, things will be nice and calm. Now, some other perks of that are that if we can get everything nice and calm, that's also helping us out with round ligament help, making sure those round ligaments are nice and bilaterally even, making sure that the sacrotuberous ligament, which goes from your sacrum to your leg, making sure that's nice and even. Those are all things that help you not just get out of low back pain, but also help you when it comes time to get that baby out. If you do have any questions, please let me know. I'd be happy to help, and let me know where we can get started. Thanks so much, guys.